What are opioids? Opioids are types of drugs that are created in a lab or are extracted from a plant known as the poppy plant, which grow in dry and warm climates. Drugs like morphine, methadone, hydrocodone, hydromorphone, fentanyl, and codeine are extracted from the plant and are used as painkillers to stimulate pleasure feeling. Opioids are usually prescribed by doctors to treat patients who are in heavy pain. However, there are some types of opioids that are illegal to consume, like heroin. Not taking precaution to opioids that are consumed can lead to many negative health problems due to forming a nasty addiction. What is the opioid epidemic? According to an article from Vox.com written by German Lopez, the opioid epidemic started back in the 1990s, beginning with the excessive prescription of different opioid drugs. Patients began to resort to the extreme type of opioid drugs like the absolute illegal heroin and dangerous oxycodone. The epidemic was said to start in white rural populations but had spread to other areas as time passed. How do opioids affect people? Again, opioids are meant to be painkillers, but becoming addicted to them can lead to overdose, which can also lead to drastic health problems or ultimately death. The health problems can include brain damage, depression, liver damage, constipation, nausea, vomiting, and many other disastrous and painful side effects. Pregnant mothers especially must be cautious, as use of drugs can create birth defects for their children, both physically and mentally. This is known as the neonatal abstinence syndrome, which refers to when a baby is born addicted to the same drug as the mother was. Since the baby won't have the mother providing the drugs to them anymore, it can suffer from said birth defects and intense behaviors like withdrawals and seizures. Most affected states in the USA. The use of opioids has affected states from all across the United States. West Virginia specifically had some of the worst impacts from the epidemic. The city had been completely infested by an opioid takeover, having many accidents with citizens passing out from overdoses in the street during daylight. Residents in charge were especially shocked to one day find 26 different people having overdoses in just one day. Other states that struggled with the opioid epidemic include New York, New Mexico, Utah, Ohio, Kentucky, and many others that all suffered from the same common issues West Virginia did, like addiction and overdose. According to a chart from the National Institute of Drug Abuse, the number of deaths that were caused by the use of opioids have increased exponentially from 2002 to 2017, spiking up especially at the year 2016. It also seems that males have a higher opioid usage rate than females, with the ratio being about 9-2. The death rate became so devastating that even President Donald Trump declared it a national public health emergency in 2017 and created funding to help fight drug addiction and the opioid epidemic. Treatment for opioid addiction. Treatments for pain can vary depending on each person, ranging from different medicines like ibuprofen, aspirin, and other non-opioid medication to meeting for therapy with a specific counselor. Other types of treatment also include radio waves, nerve blocks, electrical signals, and other relief-type therapies that can help reduce chronic pain. In conclusion, opioids are drugs that can help deal with basic to severe pain. However, not using the medication properly can result in heavy drug addictions that can lead to serious health problems and possibly death. Every addiction can have a possibility to relapse, but seeking help is crucial to be able to stop deathly overdoses from addictions.